Hi there, it's Nikki from South Lane Dental. Just a quick little lesson on how to look after our teeth with our toothbrushing. So when we brush our teeth, we want to make sure that we brush around the gum margin and into that little crevice. We have a 2 to 3 millimetre gap around the gums and teeth. They don't just stick straight onto the tooth. We have that little crevice. If you take your finger and you have a look at your fingernail and the nail bed, it's a similar principle. So that little gap in there that we clean out with our nail brush, or however we clean our nails after we've done some gardening, it's a similar principle. You have a crevice there. We need to clean into that crevice. So when you're angling your toothbrush, you want to make sure that you get it into that gum margin. Now you may have an electric toothbrush. Electric toothbrushes do all the work. So that brushing action is, you don't have to concentrate on that, you just let the brush do the work for you. Make sure that you angle the toothbrush. So for the lowers, you would angle down. So I'm just going to get that and try and show you there. So you've just got that 45-degree angle. You don't need to be exact, but what you're trying to do is get that brush so it gets into that gum margin. With the brush turned on, spend about 5 seconds per tooth and then move around to the next tooth. Okay, obviously around the fronts, pull your lip out the way so that you can get the lip into this area down here. So again, just that 45-degree angle to be able to get the toothbrush into the gum margins. Do all of the outsides of the teeth, then do the insides. Now a lot of patients struggle with the inside areas because our tongue gets in the way. So make sure you have your toothbrush up on its end for the front teeth, because you'll have more access of getting into those front areas there. And then have the toothbrush, so we go long ways again into this back area. Now one thing that is useful for the electric toothbrush is a little tufted head. So you can get these all be interspaced, or a tufted toothbrush, to be able to get on these inside areas a lot easier. Okay, so you've just got that angle so you can get the brush into this area. So you can see it just makes it easier access for those inside areas. Same on the top. So again, with your electric toothbrush, angling the bristles so that they get up into those gum margins. Okay, so angling up this time, sort of like a nice 45-degree angle, but just imagine it's getting right up into those gum margins. If your gums bleed when you brush them, this may indicate, and most likely will indicate, that you may have missed an area of brushing the night before. Bacteria's built up, your gums have become inflamed. The way to sort this is to make sure that you give that area a little bit of extra attention, and you'll find within a couple of days that bleeding will settle. Manual toothbrushing. So with your manual toothbrush, make sure that you angle again the bristles into the gum margins, and you use a circular motion, just making sure the bristles are into those areas there. Make sure that you're just getting around, and again moving your lip out the way to be able to get into that area around here. So with a manual toothbrush, you're using small circular strokes. Some of us are a bit heavy-handed with our brushing, so the recommendation would be to look how you're holding your toothbrush. Hold your toothbrush like you would do a pen. That way it just lightens off the load. The same with your electric toothbrush, hold it like a pen. Again, any bleeding when you're brushing with your manual toothbrush may just indicate that you need to concentrate on that area. I will show you in my own mouth. So here we go with my electric toothbrush. The idea is, again, you're getting the bristles into the gums. So I'm going to show you. Angle. In the back teeth, the best thing you can do is close slightly together. So I'm going to show you right in the back. Another point is look in the mirror. You'll be surprised what you can see in the back of your mouth. Pull your cheek out the way and get there. Okay, so that's how I would do the top at the back, obviously all the way round. Low is exactly the same. And lowers are exactly the same. So again, start at the back, work your way around all the way to the front and around to the back. Watch that typical thing, being right-handed. We tend to brush better on our left. We get to this point here where we twist our brush, and quite often you can end up missing that corner. So a lot of you will get that bit of inflammation, bit of bleeding around the corner. So if you're right-handed, we tend to miss the right-hand side. I hope that's of help. I think the most important thing to remember, if you get a bit of bleeding, don't panic. If you see a bit of blood there, just give that area a bit of an extra clean. Any problems, please email us and we can offer you advice. Take care.